What are tonsil stones? Basic information. Let us first have an idea of what are tonsil stones, prior to discussing how to get rid of them, how they are formed and what they are actually made of. Those who know what are tonsil stones can successfully devise the ways to remove them. Tonsillolith is a commonly used medical term, and laymen call them tonsil stones. These stones are actually calcium deposits formed either in palatine or lingual tonsil. Primarily, they are made up of calcium, but they may contain carbonate, phosphorus and ammonia. Symptoms of tonsil stones. Several reports have revealed that tonsil stones are more common in grown-ups than in the young children. Pain in swallowing food and bad breath emanating from your mouth are the two major symptoms which indicate that you have tonsil stones. There are several other symptoms like tightening of the throat, choking of the throat and constant coughing. If you want to determine whether you are suffering from tonsillolith, then you should go for CT scans and X-rays. In the chronic cases of tonsilloliths, patients may suffer from issues like infection of tonsils, severe ear pain, white color debris and a lot more. It is at this juncture that they should take immediate steps to remove the tonsils. How are tonsil stones formed? Before discussing how the tonsil stones can be removed successfully, it is important to know how they are formed. Human tonsils have plenty of surfaces where harmful microorganisms like bacteria, sometimes dead and worn cells and sometimes mucus accumulates. There are situations where these debris becomes concentrated, resulting in white formations. Tonsil stones are actually formed due to calcification or solidification of the debris accumulated in the crevices of tonsils. They are formed either in the throat or on the roof of our mouth. There are several factors like nasal or sinus infection, stress, inhaling of toxins, autoimmune disorders and allergy which contribute to the formation of tonsil stones. Removal of tonsil stones. There are two ways through which tonsil stones can be removed: natural treatment or removal through surgery. The apartment procedure for the removal of tonsil stones depends largely on the size of the stone. If the size of the stone is not big enough and it is not causing any discomfort, pain or related symptoms, then it can be removed at home with the help of natural treatment without the help of a doctor. There are times when the tonsil stones become considerably large and are accompanied by a lot of symptoms. In this type of situation, you must get the stones removed surgically. For removing small tonsil stones, you can try gargling with non-alcoholic mouthwash or with salty lukewarm water. Use antibiotics. Brush them with a toothbrush. For removing larger stones, laser resurfacing is a preferred surgical method to remove toxins. Laser resurfacing is a procedure in which patients are given local anesthesia and then scanned carbon dioxide is given. With the help of this type of procedure, crevices on the tonsil that traps debris are flattened. This is a permanent cure for tonsil stones.